Okay.
So, hi everyone from everywhere in the world.
Hello.
We're here today with two very special guests, and it's actually a very special day because we have a reunion of two of the most extraordinary people I know in my life. Super strong, super wise, and I have the honor to sit here today with them and listen to their stories and share this with the rest of the world. One is Melanie Roche. It's a long-term cancer survivor. I will let you tell your story shortly. And Dr. Minas Chrysopoulou, the president of the Pyramid Plastic Surgery Group of St. Antonio, and a fantastic plastic surgeon. Hi.
Hello.
Hi.
So, Melanie, how is it to be here and see Minas again?
Minas, it's wonderful to see you.
Likewise. How long has it been? It's been
Well,
a
I
while.
just looked it up 10 minutes ago. So everyone, first of all, I'm really happy that you two have connected. I'm thrilled about that. And Minas did my prophylactic mastectomy and reconstructions, both breasts, on the 8th of April, 2013. So eight plus years ago already. And they're holding up quite well, I should say. And literally every doctor who examines me says, "Oh, great job," or "Oh," and I feel like myself again, which is such a testament to you, really. And we had such a funny, surprising way of meeting initially. So I'm forever grateful to you. That way was that other surgeons were insisting that I shouldn't work with someone I had found online, which speaks to what you're going to ask about, Susanna. And, you were so and are so gracious and so generous with your time and squeezed me in to explain what the surgery would be like. And really, it was quite easy reading the thousands of testimonials from women who had flown all the way to Texas. It was quite easy to say, "You're my person, you're my surgeon." And yeah. And I'm very happy with the results and to be alive. And it's thanks to you in large part. So thank you.
Thank you. You're way too kind, but I remember it. I can't believe it was 2013 because it seems way more recent, but that's life, right? Yeah. And thankfully we don't hear those comments quite so often as we used to back then, in terms of other physician teams kind of belittling patients, advocating for themselves, and sometimes that involves travel to get the right access to what you believe is what you need. So I'm always excited to talk about it, and talking with the two of you, there are no better people out there to have this conversation with. So I'm glad we're doing this. So, and Melanie, I mean, you need to know yourself that you have and continue to enrich the lives of countless people. So that's just never ever forget that.
I appreciate hearing that right now, especially because I am in recurrence, you probably heard. And this is my wig made out of plastic bags. These are my eyebrows drawn on with a pencil, about to have major surgery, but feeling very well, and wouldn't even know I was in recurrence if not for the blood tests every 3 weeks and so on. So that also speaks to precision medicine. But thank you for saying that, because I love my work. And I remember asking you strange questions, Minas, and you not belittling them at all, and really saying, "No one's ever asked me that before. Let me try to answer."
Yeah, well, it's how we grow, right? I mean,
yes. And I'm thrilled that you're publishing now and presenting, and people are learning from you and not belittling your work either, but
Well, you
on the
know,
contrary.
at some point, you know, if you keep talking, then at some point someone somewhere listens, right?
And that's
Yes.
the power of shining the light, right? If you
Yeah,
do
that's
something
right.
good
Yeah.
and something that's not there in the world, it's so important that someone stands up and someone continues to stand up and to speak out. And then you will see the people where you fight for. More people will unite, and more we can do together. And yeah, that is also what unites us, of course. All the conversations we previously had about how can we improve access to care, how can we make life-saving information available for everyone around the world, and how can we help patients in their search for the right medical expertise, and even to get more insight into their health situation and in their options and what they can do to feel more in control, less powerless. And Melanie, today, a few weeks ago, we talked about the power of patient literacy, being able to find the information that is specifically relevant for your own case and can help you. But I think today is also a very special day because in 8 days, you will have your new surgery, correct?
Yes, I believe it's 8 days, on the 11th of
Yes.
August. Yes, very soon.
So can you tell us a bit more about that?
Yes. And since our time is limited, I want to tie it in with your question about precision medicine as well. So I'm genetically at high risk. I have the BRCA1 gene, which Minas is how I found you, because I learned at age 33 that I needed prophylactic mastectomy and oophorectomy, and I could not bring myself to do the surgeries, and ended up at age 48 in 2012 being diagnosed with fallopian tube cancer. And after that, then I was willing to do prophylactic mastectomies, and the surgery had improved so much in those ensuing years that when I went for my second opinion at MD Anderson, and they said, you know, you really might reconsider, because now you can do it all in one and keep your own skin, your own nipples, and so on. And that was how I found you, Minas. So my case is unusual in that I have passed the 9-year mark with fallopian tube cancer. Very unusual. And I'm now in my 6th recurrence. So I'm in my 7th time going through cancer in nearly 10 years. And I feel really well. And honestly, if I hadn't done the genetic testing and known my family history, and now repeating the blood tests every few weeks, well, every week, because we do chemo, I sometimes have to ask for it to be repeated that frequently, but it's because of those tests, it's because of the genetic testing, it's because of the tumor marker numbers that I am still alive, and we keep catching it early enough that I can have surgery, or I can have the right chemo, or we can adjust treatment. So precision medicine is saving my life already, and I'm one of the early adopters of it. It's now becoming a lot more mainstream. I was, tested in the first year.
Yeah.
The genetic testing was available, I believe. So
Yes.
am I answering your question or not? Not quite. Oh,
Yeah,
you
yeah.
asked about the upcoming surgery.
And yeah,
so-
now you have the surgery, and
Yeah.
I know if the conversations that we had, that you are of course, through all those years and who you are, and you know so much, but maybe you can tell something about your search. What was important for you to look and to get access to this surgery, because that was not the most standard choice, right?
That's exactly right. So, last time we talked about medical literacy, and the articles I was reading were saying that women who have liver metastases are typically treated only with chemotherapy, because it's assumed that we'll die, basically, and surgery isn't considered worth it or a worthwhile expenditure. And different countries have different points of view. We talked about that last time. In the US and Great Britain, surgery is very strongly offered, and in the Netherlands, not. So in November, when I read that article and I learned that women who have liver mets can have the surgery to remove them. And in my case, it's going to be a whole right hemihepatectomy. So the entire right side of my liver is going to be removed because I have spots that are straddling segment 7 and 8 and a little bit in 6, and even one that might be in segment 2 that we're not sure if it's cancer. So we might take a little bit of the left side as well. But when I read that article that said a woman who has liver mets and only does chemo lives on average 10 to 12 months. Yeah. And a woman who does the surgery and then chemo lives maybe 4 years. I thought, you know what? I really want that surgery. Yeah. And I don't feel sick. And people keep telling me, everyone was telling me, you know, you really ought to think about end of life and what you want. Yeah. And every time I went for imaging, it hadn't spread beyond my liver. So my case is unusual in that usually with fallopian tube cancer, ovarian cancer, you get carcinomatosis, these tiny little spots everywhere. I've never had that. Yeah. I don't know if that's because of my histology or that it was transitional cell carcinoma, not ovarian cancer. Anyway, I've been very fortunate in that I keep having solid lesions that can be removed. So in November, when the liver team at my hospital said it's technically possible, yeah. My oncologist said no, and I couldn't quite believe it. And so for months now, it's now August, yeah. I have been every appointment really saying, I don't feel sick yet, or, you know, and then I became platinum resistant. So I know I'm heading into late stage. And again, I felt like the liver takes chemo and metabolizes it differently than other organs. So perhaps the monotherapy paclitaxel that I'm on right now that's keeping my disease stable, well, maybe it would work better if we could actually remove the spots. Yeah. And I don't know yet. That's number one. Number two, I got vaccinated for COVID, and every time I had vaccine number 1 and vaccine number 2, my tumor marker plummeted. Yeah. I mean, like a 400-point drop in a week after the vaccine, the first one, and I forget how many, but a big drop after the second one. And we really don't know why yet. Did it boost my immune system? What's going on with the vaccine? Have I done so much chemo that my immune system can't, it's just not working as well as it used to? Yeah. We don't really know. But again, the testing, the combination of testing and advocacy finally worked, finally succeeded. And again, when the MRI only showed it in my liver, she said yes. And the committee had said yes. And the multidisciplinary team at the hospital said yes.
I find this still a very extraordinary example, because over and over again, because this seems always to be the case with you, it's unique. They don't know your case. They haven't seen it. If you talk about precision medicine, I think this is yet another good example where you see that you cannot treat everyone in the same way with the same protocol and follow the same steps. That is very important to also look to other criteria, to look to someone's health, how strong someone is. You're extremely strong will to also survive this and go through this, and your health. So these are all factors that also are important during decision making, and to see like what kind of treatment would be possible. Maybe Minas, to go to you as a doctor. How do you look at this?
I don't know of a better example to highlight the importance of patient involvement in moving precision medicine forward. Because by definition, you can't have precision medicine move forward without patient involvement and shared decision making, right? patients drive change. I've been saying it for years, and my colleagues hate hearing it, but it's the truth. Physicians, like all humans, tend to be status quo beings. We do things because it's the way we were taught, it's what we learned, it's what the journals say back then, because what percentage of physicians are truly up to date, right? With the absolute latest, even within their little niche.
So much information.
So much information. And I don't mean that as a dig. What I'm saying is really, it's impossible to really try and keep up with everything. You just can't do it. That's why we need AI, right? It's not feasible. And so if you're willing to empower the patient and then take their data, obviously with their consent, share all this, really it's a massive, massive opportunity. And precision medicine isn't really a new concept, right? Blood transfusion. That's precision medicine, right? You don't give, if someone needs blood, you don't give them any old blood, right? You match their blood type. That's actually precision medicine. The concept isn't new. It's just now with tech and in combination with patient advocacy, it's really a very exciting and wonderful opportunity to truly move things forward, especially since now, there shouldn't be any, boundaries. We don't even have countries serving as, barriers to this because of, access, social media, online or social genomics. Look at what you're trying to do, right? So what you're doing, actually. So I think this is Melanie, thank you for sharing it, because it just highlights the importance, right? You had a bunch of people saying, oh, you really should consider end of life. Well, you know what? I'm not ready.
Yeah.
Okay.
Yes.
And the fact that I'm not ready trumps what you think I should be doing.
Yeah.
So, and really, you look at the shared decision-making piece, and really what we're talking about here, in my opinion, is patient autonomy, right? It's empowerment of the patient to make the choice as to the degree of decision-making they choose to have or choose to make, right? Because, some colleagues who who misinterpret shared decision-making and think it's just explaining all the risks of something. Well, no, you can explain all the risks of something, as you should as any physician, but you can still be very paternalistic in your exchange, with the patient. And a lot of my colleagues don't understand that if you give the patient the opportunity, and then the patient actually volunteers to say, look, doc, I'm so overwhelmed, thank you for talking to me like this, but where the space I'm in right now, I actually need for you to tell me what you would do if I were your wife. Even though the patient is handing over the decision-making to me, that's their decision to do so. That is still shared decision-making.
Exactly.
So it's very complex. I think we can't lose sight of the autonomy piece, because patients want to have different degrees of decision making based on where they are, on their lifestyle, the situation. It's very situational.
I respect that, and I admire that point of view that gives the patient's choice. And I also feel like if gently and with great sensitivity to listen to what the patient wants, a doctor can teach patient literacy, or other people can teach patient literacy, then a patient might rise to the occasion and say, oh, I didn't know this. Actually, here's what I want. If it's foisted on them, that doesn't work. But, I had my father-in-law say, go ahead, what were you going to say?
No, I was going to say that's such an important point, because that draws a distinction between health literacy and e-health, right?
Yes.
Because access to information online is not health literacy, right?
Yeah.
So there's plenty of opportunity for access online in terms of information, but the ability to take that information, understand it, and do something with it, that's a completely different ballgame. That's where literacy comes in.
Yeah.
So that's
Yes.
just a really important point that you just
Yeah.
raised.
And that's of course also where the role of technology comes in to help both patients, their relatives, but also the physicians during this process. Like we all know, time is the most precious thing that we have. So everything we can do, I think, to get the right pieces together faster would help everyone to move forward
And
faster to beat the cancer.
I agree. And I would love to see a world where all of the armamentarium, let's call it, is presented. And we can actually study it and see what's efficacious. And if it's not efficacious, then my colleagues, who I believe are into magical thinking, are wasting their time and wasting the patient's time. But if it happens to be efficacious, for example, with social genomics and so on, well, then let's consciously choose to include that in the protocol. So for example, if we know exercise helps improve survival, if we know women who have ovarian cancer who feel lonely metastasize sooner and die more quickly, well, then a woman knowing that can say, am I feeling lonely?
Yeah.
Especially during the pandemic. Well, what do I need to do about that? Shall I reach out to a friend? What do I want to do about that? If I'm feeling stressed, and we know that stress affects gene expression, well, that's very easy to learn tools like meditation to address stress. For me, if I'm feeling stressed, I know that it means there's something bothering me that I need to address. There's something I'm worried about. And if I can get to the heart of it through advocacy, then or conversations, then I calm down. Then I'm not hyper vigilant anymore.
So
oh, sorry.
I was going to ask Melanie, so if what we're talking about resonates with someone who has a health issue, medical issue, but they're not sensing, it takes two to have a conversation, to have a discussion, right? So if they're sensing that their healthcare professional, be it their physician, their nurse, their whatever, they're not getting the vibes that this is going to be a collaborative exchange, collaborative relationship. Do you have any advice for people how to handle that?
Yes, I think, and I've been in that situation before, when you feel like there isn't a match, to trust your gut and shop around. The patient as consumer vibe or belief that started in the 80s, I guess, is now in full swing. So if a patient is with a doctor and it's not a fit, to choose someone who is. And it might be simple, can I talk to this person? It might be bedside manner. It might be, will they meet me where I am and give me the information I'm asking for, just as you just described. I have left oncologists who were very well known, where I had to write letters to beg to become their patient, cutting edge, top physicians, where I just felt like, she says the same thing to every patient. I hear her in the next room saying what she just said to me. And too much Botox, and there's no there. Nobody's home, And I just felt like, okay, this is not my doctor. And I switched. And the doctor I switched to said, what brings you? And I told him, and he said, you must be really worried right now. You must be at your wit's end. How can I help you? And I was really worried. And the fact that he even mirrored that back to me, at that point, I was in, month 12 of watching my tumor marker increase, and nothing was showing on imaging yet, but I knew I was heading into recurrence. It was so helpful to have someone reflect that back to me. So I would say, find someone, develop a whole team of people that you feel you can be your complete self with.
and a deep connection that you then feel with the person. I also know that one day we were on the phone, and you came back from the doctor, and it did not feel good. And like you
Yes.
said, very qualified. But and I tried I asked you things because I thought let's see where this comes from. And this was about that maybe unconsciously, because of your case, she thought you would not make it, and give you an expression or in her way of doing had the level of willingness to fight while you were the fighter, and like, this is not the end. So it's very important to have someone with this connection, but also if you want to fight, to have a doctor who fights with you, right? So that you feel like you're strengthening each other. I think that's very important.
She's a fantastic doctor, and generally we have a great relationship. But in this one case, I felt like she was following a protocol, which is true. I know I'm going to die of this, or die. We're all going to die, but I'll probably die of this, and it may not be that far down the road. I'm not acting like now I can cure myself, but I had to connect to a colleague of hers who shared a mentor with her and say, could the two of you converse about my case? I paid a lot of money to have this other person say, oh, this is an unusual case. Let's re-examine this. And that worked. But it took a lot of, and I'm an immigrant here. So really, Susanna, it was only because I knew you that the synchronicity could happen, that then I could meet the colleague and the mentor, and the connection between the three of them helped me. It is helping me so much. So there too, I could have searched online, but I really needed a community of real human beings. And you have been that for me often.
Thank you.
Thank you.
It's very special how we are connected.
I know. Keep having these moments.
The all three of us.
Yes, it's true. It's really true.
Well, for today, we need to finish this wonderful conversation, and I hope we can continue the talk more times. But for now, I want to thank both of you, and thank you for being here and being my friend.
Yeah.
This has been wonderful, ladies. I really appreciate you including me.
Oh.
Lovely to see you both.
Lovely to see you as well. Susanna, great work you're doing. I know you have a meeting, but thank you for all you're doing. It's so wonderful. And I hope to see you both again after the surgery, and hopefully we'll continue the conversation once
It's a date.
It's
a date.
That sounds great. All right.
Okay, well, okay,
Yeah.
bye.
Bye,
Take care.
Bye.
Thank you, Barry. Bye. Bye.